Hey, welcome back, everybody. Got another special edition of Lionheart Health, the one show, the only show that takes you into the future of health and particularly longevity with the man who's been doing this longer than anybody I know, Howard Lionheart. Welcome back, Howard.
Thank you.
Let's just catch everybody up because we do these infrequently. They may not remember what the last ones are about, but you have had a storied career in regenerating organs and other sorts of things here. You have won all sorts of awards, and a couple of years ago here at UCI, you started this company, Lionheart Health. Give us a quick summary. What's Lionheart Health all about? Because you've got so many different things, I don't think I can summarize them. What do you tell people?
Thanks, Bob, for that opportunity, and hi again, everybody. Lionheart Health is focused on regenerative medicine, and particularly the convergence of medical aesthetics and health span longevity. You mentioned awards. We were very lucky to be designated this past spring as one of the 40 semifinalists of the $101 million X Prize Health Span competition. This is a competition of which research group in the world can prove that they can reverse age or extend healthy life 20 years. There were 600 entries to begin with, and we've made it to the final 40. We're now vying to enroll patients and prove out that we can do that better than the other 39 competitors. And the next stage is to make it to the final 10. Final 10 win $1 million prize money each. We won $250,000 to make it to the final 40. And then from 10, it goes to the final 2. And the final 2, $81 million and $10 million of grand prize money. We hope to bring that.
And what do you have to do to win? You have to show that you extended life in some tangible way for how long, right?
They have 3 different judging panels made of world experts in the respective areas. And so the judging criteria is 1/3 for improvement of muscle health, which is highly tied to longevity. 1/3 of the vote of the scoring system is for brain health, cognition, and memory. As you age, you want to keep your cognition, keep your memory. And then 1/3 for immunity health, being able to fight off cancers, being able to fight off colds and pneumonia and diseases that sometimes cause people in aging to succumb earlier than they would like. So muscle, brain, and immunity health. And then if it's a tie across those 3, then there's a bunch of tiebreakers. In our case, vision improvement, helping elderly people to see better, to hear better, and joint health, sexual health. All of these things are incorporated into our Lionheart Clotho Wellness Program. So if you came to our clinic here in Newport Beach, you would meet with one of our 5 doctors, Dr. Berkey, Dr. Bourgeois, who was on the show, Dr. Szymanski, Dr. Mina, and Dr. Miller, and they would do a consultation with you. And to shorten up a long story, we basically deliver healthy meals to your house that promote Clotho.
Let's stop for 1 second.
Provide everybody with supplements.
Clotho's your secret sauce.
It
This
is.
the thing you've been pushing forever. This guy in Japan or something came up with this thing.
Remind everyone what Clotho is. A lot of people. I mean, it's the buzzword. Everyone's talking about it, but tell everyone what it is.
Klotho, right? Clotho.
That is correct.
It's a protein of some kind.
If you type Clotho in either PubMed or Google, you'll find that there are 4,288 papers published on Clotho. And the summary of those papers is, if you're low in circulating Clotho, which would be around 600 pg/ml, you are
This is
aging
some kind
more.
of protein floating through your body, right?
Yep.
Okay.
Yep. It's produced in the kidneys and produced in muscles and produced somewhere in the brain spine column. That's a little bit of a mystery, but mostly in the kidney and mostly in the muscles, and you can influence it by exercising. If you're low on Clotho, you're aging more rapidly than you should. And the data is, very compelling. One of the big ones, mortality, or the biggest one of all. If you're low on Clotho, 31% chance that you don't make it to your expected median death age, which for most people is around 82. And maybe worse than that, or more profound than that, or more impactful than that, is that you'll start declining 20 years before that if you're low on Clotho. So you start going downhill in 62 if you were supposed to make it to 82. And if you're low in Clotho, 31% chance you don't even make it to 82. And that's just the start of the Clotho story. So from the tip of your head to the bottom of your toes, you lose your cognition earlier, you lose your memory earlier, you lose your hair earlier, your skin wrinkles up more, you lose your vision, you lose your hearing, your arteries calcify, your heart valves calcify, the amyloid plaque in your brain that contributes to Alzheimer's and dementia forms more readily, you have higher blood pressure, your sexual health declines, your joints are more sore. you have a much higher chance. Of the 2,200 some papers, about 300 establish a link between cancer and clotho. And it basically establishes that if you elevate your clotho levels, it's a powerful cancer tumor suppressor and will help prevent clotho. And then other things, if you're low in clotho, higher chance to be depressed. If you're low in clotho, higher chance to be addicted to something. A study out of Scandinavia showed if you're low in clotho,
on and on and on.
It goes on and on and on.
Now, and one more thing, then we're bringing your guest. So you're out of all this, you discovered this clotho. You didn't discover clotho. You discovered these papers about clotho, and you started doing your research and stuff into it. And your other secret sauce is using bioelectrical stimulation instead of it doesn't replace regular exercise, but it's in addition to stimulate exercise in your body to fire and open and close your muscles, mimic just going out running and traditional exercise to produce more clotho, right?
That is relatively correct.
Close enough for me to understand it.
The bioelectric clotho stimulation is not contraction stimulation. It's below the contraction threshold. And we get your muscles to secrete more clotho into your body. And we have actually 70 different protein expressions. If we would take hours to talk about all 70. The two big ones are clotho and stem cell homing. So if we stimulate your knee, we get your stem cells to move from your fat to your knee. If we stimulate your face to eliminate wrinkles, we get your stem cells to move from your fat and your bone marrow and your circulating blood to your face, to your hair scalp, to your sexual organs. So we control stem cell homing without having to inject.
And so that's where we're going to bring you in. Yes.
Well, I just have a something really interesting about that. So with the biofeedback, the stem cell homing that you're talking about is really fascinating, and there's a lot of talk about that. And it's similar to like shockwave therapy, right? Where they're causing a reaction within the body, and it basically sends the stem cells there. And also some of the laser therapies. There's a group out of Germany I know that's done a lot of research on homing with laser therapies. It's similar idea. Is that correct?
Yeah, in those cases, they're actually creating injury, and the stem cells are coming to repair the injury. In our case, we deliver signals that fool the knee into believing it's been injured, so it sends
without the injury.
Without the injury.
Interesting. Yeah, very, very, very cool.
So for everybody listening now, they're saying, "Who the heck is this guy here?" This is David Kasteler from the Regenerative Research Group, which does research as well as, I guess you do sales. You call on clinics and try and have a variety of products that you represent and take in, as well as selling some of your own things. But what caught my ear was you're a biohacker. What the heck are these? Everywhere I go, Joe Rogan, Robert Kennedy Jr., everybody wants to be a biohacker. They're looking for treating our body as what would you call it, like a computer system here. And how do you hack in and hack the code? How do you make it operate better? Is that what a biohacker does?
Yeah, I think that's the idea behind biohacking. In general, biohacking is a really marketed word now, and I don't actually like the word biohacking, because I think people just use it as this. I mean, they have these biohacking events or biohacking this or that, and I think it's, if we step back, we say the goal is to live better longer. Right. So I always look at vitality, and you have this. Let's say everyone dies at 80, 82, right? But how are you living from 60 to 80? And if you look at the general population, you have high levels of obesity, high levels of people that are taking prescription medications. They don't they're not very active. And so one of the things that
why is Howard looking at me as you're telling all this?
Well, it's easy to know these things, but it's harder to implement them. And so Howard mentioned something about clotho that's interesting, and he said about as you age, your clotho goes down. Right. And he said something that is, if you're exercising, it keeps your clotho up. Well, I'll just tell you. I mean, honest fact is that everyone that I know that's extremely healthy above 60, they have very regimented exercise protocols. Now, it's not that they're doing CrossFit or anything like that, but they have very good routines around exercise and movement. And I think as we look, I mean, I'm in the business of regenerative research and longevity, biologics, things like that. And as I look at technologies around clotho and stuff like that, it's a way for us to support the body's natural mechanisms. And that's what we want. We want to support the natural healing responses, the natural responses that the body already has.
That means you got to understand how the body works,
well, correct.
how
but-
the system works. You can't hack
Yeah.
into it if you don't understand what
Well,
the software is.
Exactly, but people need to. It's easy to get into all the tech and do this, do that, take this supplement, but it really comes down to three things, and these are the three pillars that I talk about. Is that you need to really look at your sleep patterns. How can you optimize your sleep? And like right now, I'm tired. I've been stressed getting ready for this trip and everything, and I didn't sleep well, so I'm deficient on sleep. Well, then you go into biohacking and say, okay, well, what can you do to help offset some of that poor sleep? And you have
To
things
get
like,
over jet lag,
Right.
or to get over the things that you're.
and then they've got research on like creatine, adding in creatine supplementation, red light therapy,
Red light. Oh, we
different
talked
things
about
like this.
that, yeah.
But so sleep's the first one. Then you have nutrition, and your nutrition, like what are you taking into your body, and how are you taking it in? I mean, are you giving your body the nutrients it needs and the right timing, things like that. And then you have exercise. And that's where the Clotho comes in so effectively.
And why do we need help? Well, it seems so obvious. Sleep, diet, exercise.
Yeah.
We've heard this. We all know it. We
Yeah.
all believe it.
Yeah.
Yet we don't do it. We don't get enough sleep. We have crappy diets. We don't go out and we talk about exercising, but we don't do it on a regular basis or enough.
Yeah.
Or we don't know how to do it or when to do it or why to do it. So all these things slide off our to-do list here.
Well, I think our society, I mean, wouldn't you agree, Howard, it's hard. We've got these phones, they're OLED or LED light with high blue light, and people are on their phones all the
Beckoning
time.
me all the time.
Yeah,
It's
and you've
never
got
far away.
these constant dopamine hits that are causing you to want something else that maybe you should just go outside and walk around for a little bit. And now I've got a car. I don't need to drive. I don't need to walk to the market. I drive to the store, or you just Uber or Uber eat it, right?
It comes to me.
So I think our society has made it very convenient, and you have to have, like when I work with youth groups, I talk about planned privations. And I think it's very important that
Planned what?
Planned privation.
Privation. What was that?
So you're causing a stress on purpose. So like a camp out or a exercise that's planned. So you're making it difficult in some way. And I think our bodies actually like that. They thrive on that. And so think of something like a jumping jack as an example. Jumping jack's a very easy movement. Yet it's something that you don't wake up and say, I want to go do
No.
5 minutes of jumping jacks. It's actually quite hard. But when you do a jumping jack, you're causing lymphatic drainage. You're causing full body movement. It's very, very good for you. And if everyone would start just doing jumping jacks 5 minutes a day, you would see dramatic improvements in their Clotho levels. Everything would improve. But it's a bigger conversation of why are we not doing what we.
So would you say
what should do.
biohacking is our way to get a quick fix, to fix what we know we could do and should do, to supplement or add to what we don't do?
Right. I think that's a great phrase.
You talked about supplements. You came from the supplement business too, right?
Yeah, we've sold $250-300 million of supplements over the years through my companies, and it's easy to say. You look at GLP-1s right now. Everyone wants to take a GLP-1 that
Which
helps,
is what? What's it?
like semaglutide or Ozempic that
Ozempic,
helps you lose weight.
Right.
Yeah, and Regenerative and a few different ones. But everyone wants to take a shot, and so you take a shot once or twice a week or daily, depending on how your doctor is prescribing it, and it will cause you to lose weight if done properly. But over long term, they've shown that it can cause problems with liver and different things, and so there's
muscle loss.
Muscle loss. Yeah, there's some interesting research, and so people want the short, quick fix, when really they just need to walk for a little bit every day,
and eat better and sleep
and
better.
change better. So I think biohacking. I like the term, but I don't like the term at the same time because it's used for marketing too much. But the idea is, look, we want to be cognizant of our health and our wellness, and how are we aging? Are we aging in a good, healthy way, so that when you're 65, 70 years old, you can still run and walk and go on a hike. You can be with your grandkids or your friends and do these activities. And so when you look at the longevity areas or the blue zones, you'll notice that they
are blue zones. But there are places out there that just people are living and eating and somehow surviving better. These blue zones they talk about.
Right, and those blue zones, I mean, you have community. You have discussion happening. You have,
and that's what this is right here, Paul. And you serve yourself up as a radio announcer, but what we're talking about right here is working. What I mean by that is that the baby boomers which you and I, Paul, are part of, are realizing this more than any other generation. My grandfather wouldn't have thought about longevity or wellness or adapting what he wanted to eat or exercising outside of work. He was exhausted when he got home from work.
Right.
But the data is showing that more and more and more people are understanding preventative medicine is better than sick medicine. And one way to frame it, that we have a public audience here, not a bunch of scientists. And Michael Levin at one of the conferences said something similar, and I've kind of adapted it. What he said was the way to longevity is to fool Mother Nature that you're still used to the society. So most of the time of human civilization, we were nomadic. We had to go hunt the woolly mammoth, and everybody had to move. And nature or biology or whatever you want, if you ended up not thinking, not using your muscles, not having sex, and you basically told nature or biology you're no longer useful to the tribe, it was better for the tribe to have you die off. So what happens is when you show biology you're no longer useful to the tribe, it wants to kill you off. So it starts lowering your clothes.
You don't move, you don't reproduce.
So if you want to fool it,
you
you got to keep moving, use those damn muscles. You got to keep thinking, use that brain, and have some sex. And then you fool Mother Nature into thinking you're still useful to the tribe, and it doesn't want to kill you off.
Wow. Well, wasn't there, Howard? I think wasn't there a study about this, about retiring? I think I remember reading a study that showed the people that retire and don't do anything, that they're less happy, they have more depression, but ultimately I think you do die quicker. I don't know if there's been. I thought there was a study about that.
That's certainly been my observation in life. That too many people are active and then they retire, because I'm getting close to those ages, and I look ahead at some who've preceded me. Yeah, they preceded me in death too.
Well, I think you need to have a desire. I mean, that's what makes life worth
Get you up living. In the morning.
I mean, we're both doing this because we enjoy it and we like helping people. It's fun to have someone come to you and say, "Hey, this really helped me," and thank you.
So I got to ask you one question here, because what's the difference between? So we talked about biohacking and we talked about bioelectric stimulation, somehow hacking into your body system or using electricity to stimulate. If you're not exercising enough, we can help that or supplant that. What is the difference between? Maybe I'll throw it this. I'll phrase it this way: if they came to Lionheart clinics, health clinics, those, what do you get, 6 or 7 around the country now here?
7 now, and I'm about to have more.
More, because your goal is like 100 or something.
124 is our goal.
Okay. And so people come, they pay to come in and do these, work with their diet, work with all the sleep and exercise and everything, and to try and find some biohacks, some way to help them do what they're not doing. You said, though, that nothing works 100% of the time, and you're always looking for other things to add to it, to stimulate. Talk the difference between bioelectric stimulation and this kind of, what would you call it, biologics? Is that the buzzword? They used to say like stem cells and other sorts of things, but biologics seems to be a broader thing of using what? Define biologics for me, because that seems to be what David does.
Well, I'll start that we began our research in this area with biologics. We injected stem cells in an animal heart in 1988 with Dr. Ray Scow and Dr. George McGovern, and published in the Physiologist the first time of regenerating a damaged heart. This was a dog. And we repaired that dog heart with muscle stem cells. And long story forward, we went into human trials, 52 sites, Mayo Clinic, Cleveland Clinic, finished and published a pilot study of phase 1, a phase 2, a phase 3. In the laboratory, as we always have a laboratory, we were trying to find ways to improve our first generation. Our first generation was taking muscle stem cells from your thigh, cultured them in a laboratory, and then making one injection in the scar tissue of our heart after a heart attack. What we learned in the laboratory is if we added nutrient hydrogel, we got more survival of the cells and
Did
more
better.
muscle built and
Did
more
better.
blood vessels.
Right.
And then bioelectric stimulation came in, and we developed a pacemaker-like device, and we combined the biologics with the bioelectric, and we found that we got more muscle, more blood vessels, and the heart got better if we did that. And we're still doing that today. In some time point after spending $130 million in 20 years working on regenerating hearts, we got together and had a lab meeting and said, hey, we've learned a lot about stem cells. We learned a lot about bioelectricity. We've learned a lot about how to get that organ to be stronger. Maybe what we learned for the heart, it might be useful for something else. So somebody in the room said, what about skin regeneration? A lot of people want to get rid of their wrinkles. Somebody else said, what
Different
about hair
organs.
loss?
Yeah, right.
Somebody else said, what about sexual health decline? Somebody else said, what about joint health? And again, to shorten the story up, we developed products, got them through the FDA for those applications. And, you know, the good thing from, we always have investors, those lighter things, skin regeneration, hair regeneration, they go through the FDA quicker. Deep organs, regenerating hearts, livers, pancreas,
Harder takes longer.
it takes a lot longer and a lot more money to get through the FDA.
And there's probably more people Googling right now sexual health or hair loss or weight loss. Maybe this is a place you start. You always said this isn't the end goal of the company, but it's kind of a starting place. You get people in the mindset of thinking of these things, using these things, approaching these, whatever, biohacks, if that's a bad word, to improve your longevity in your body's operating system.
One example is the erectile dysfunction that was leading towards your question. Bioelectric alone, 115 patients in a clinical trial, we had 89% success.
That's what you were saying, right?
We stimulated to revive the muscle, to grow new blood vessels that lasted and did not leak, and to modulate improvement of nerve connections. That means we failed 11% of the time.
Right.
So for the 11% of the time where we failed, we're now moving to add biologics. And
Which is what?
I'm going to let David explain that.
All right.
Yeah, so great. And just so everyone knows, people that have ED, it's important that they're looking at other things because ED is a precursor for heart disease and stroke. It's a precursor, so make sure that if you know
Because your
someone
blood's not working, or your blood flow is
correct,
not
yeah,
working. Right.
It's like an oil warning light that you're lucky you have that instead of a heart
Right.
attack or a stroke.
exactly.
Interesting. Okay.
And where biologics come in is you can use. I mean, there's all different types of biologics. You have different compounds and things that are being used for regenerative health and
Some of
longevity.
those would be like the supplements or something you take or
Most
ingest, or-
most biologics are injections, and you do them under the prescription. So you have general like PRP and things like that, PRF, and these are biologics that can be utilized for certain areas, knees, different general longevity.
Would this also be like hormones or growth hormones?
No, not as much growth hormone. Those are more. You have different. I mean, those are hormones, and then you have peptides, and then you have biologics. Biologics are more human cell and tissue products, usually Reg 361 products that are using human cell and tissue products really, and they're for certain areas or certain ailments based on what the doctor.
So I got to stop you. I don't want to go down the rabbit hole too much, but
Yeah.
I not that long ago, there was a big pushback against stem cells. I used to years ago work with the late great Maureen Reagan. Her father had Alzheimer's terribly bad, and they knew that there were stem cells treatments that could help or that were worth pursuing. And Nancy Reagan famously said, let's try this. But at that time, I thought the only way they got stem cells was from embryonic stem cells, aborted babies or whatever. And that would pushed a huge pushback against the whole field of stem cell research.
Yeah, there's some nuances within biologics that you need to kind of navigate through.
Okay.
And so, I mean, recently RFK, he even talked about him going to the Bahamas to receive some stem cell treatments.
Yes, right.
And his question was, well, why do I have to go to Bahamas to get stem cell treatments when they have companies that are doing great stem cells and stem cell research here? And so I think part of the pushback was because a lot of people do think that stem cells come from embryos, and embryos do. I mean, look, you start as a sperm and an egg, and then you have zygote, and that metastasizes and grows to basically become a globule of stem cells.
Right.
And those stem cells are awesome because stem cells can become different parts of your whole body. and
That's the embryo, the little forming baby here.
Not the embryo, but the cells themselves.
Oh, okay. Right.
And so there was research originally done on embryos where they took embryos and they utilized those cells for different research. But that's been stopped in the U.S. for years. I mean, like 25, 30 years. It's never
So
been done.
That's not how they harvest
It's
stem cells
completely
anymore,
illegal.
right?
Yeah. So what they found is that umbilical cord and placenta from a healthy birth. So this is post birth, after the baby is healthy and delivered. You can utilize and umbilical cord itself is like 80% stem cell. I mean,
Wow.
you got Wharton's jelly inside and stem cell.
Otherwise, you're just going to throw that thing away.
Right. And it'd be discarded. So they've done some cool research, and it's interesting. They've had birth mothers that have cancers and different diseases all over their body, and that disease never transfers to the baby. So there's something special in the stem cell and in the placenta and the umbilical cord. And so most stem cells in the world, if you go to get a biologic treatment, they would come from an umbilical and placental tissue post birth. Now there's different varying quality levels, and there's different things that have to be looked at, but it's a little bit difficult to navigate and understand where and how stem cells and exosomes and where they come from, because there are some nuances. And I think the general consensus, and everyone agrees with, is look, you don't get stem cells from embryos. And as long as you're
aborted babies, that whole idea.
Correct. Yeah.
David, you live in Utah. You might want to talk about the recent legislation in Utah that was landmark legislation.
And we helped with that. So there's SB 199, Senate Bill 199, and basically in Utah, stem cells are completely legal to administer and utilize as long as it's with a disclaimer. And then recently in Florida it was SB 1768, and they said practitioners can utilize stem cells for three things, and it was wound care, orthopedics, and pain management. And
so that's a big change, because you're talking two very religiously conservative parts of the country here that had previously kind of pushed back again, had pushed back at this whole idea. You're saying because they changed how they harvested them from umbilical cords.
So it's non-embryonic.
Non-embryonic.
Yeah.
So we're not dealing with that
placental
issue.
and umbilical cord tissue.
And also the other thing is, there's a certain, I don't want to overcharacterize, you guys are going to beat me up, but there's a certain scare factor when you talk about stem cells and things like that. I don't know what it is and how it works, and you guys are comfortable doing this. Is society getting more comfortable with this idea of taking cells from your body and using it to regenerate things?
Well, I think like what Howard said is exactly right, where people are wanting to look at their own health more. And we look at alcohol use as an example. Alcohol consumption, I read somewhere, I think it was 40% decline.
I just read that the other day.
And that's a big number. And so now you look at people where, like, your generation didn't go to the gym very often. My generation started going to the gym, and now the new generation...
Mine never heard of a gym.
Right. And the new generation, it's just part of life.
And that's what they saw with the alcohol study, that the people who are still consuming alcohol are my age, in the 60s or whatever. The people who are my children or grandchildren, they're the ones that used to be the partiers. Usually you drank heavy in youth and then you slacked off as you got older. Body couldn't take it. Now it's the opposite. They're starting off saying, I don't want to even go down that road.
So I think people are more, I mean, Howard, you'd have to probably agree with this, that people are more interested in their own personal health, right? And I think health is becoming personalized. Would you agree with that?
You know, Steve Jobs, that is known by everybody on planet Earth just about, is a testimony to what good does it be to be the richest, most famous, most revered person in the world if you don't have your health. And,
right.
And we all have our own personal examples that are much more personal than Steve Jobs, that
He died
we've lost people
too
that we
young,
went to high school with.
Yep.
And, you know, the people are realizing the real health, the real wealth is health. You know, we live in this very wealthy community. A few blocks from here, there's 30, 40, $50 million houses. What good does it do to have the $50 million house and not have your health? And people are getting smarter. And what's happening is, I had my friend Sean in Florida say, I ran into a colleague of mine, a high school buddy. He's 62. He said his high school buddy looked like he's 38. And he said, "What the heck are you doing?" And he said, "I'm going to a longevity wellness clinic. I'm fully embracing it. I'm moving. I'm using my brain. I'm purposeful work. I'm improving my social interactions. I'm managing my stress. I'm managing my sleep, and it's working." And he said, "Man, I can see it's working." So,
Well, we've all met someone that is, let's say 60, 65, and they look really old. And then you've also met someone that's 65 who looks great. And then you have to ask yourself, okay, what are they doing differently? And what are you doing now on your daily routine, your daily basis that is going to change that trajectory, right? So let's say both of them will die at 82, let's say. But their last 10, 15, 20 years is going to be very different. And I think people are realizing that's what they want.
Can I jump in and take this to a
Absolutely.
personal level?
Yeah.
So I'm the oldest one in the room here. That's why I'm off camera. And I am closing in on 70 here. And I am that leading edge of the baby boomers who watch their parents age and die miserably. It wasn't that they died. Yes, we all want to live longer. I get that. But I want to live better. And even the flip side of it, it's not just about looking better and hey, wow, you still look good and I can walk and run. I don't want to go through what they did, which was miserable, which was my mother had Parkinson's, my dad had all sorts of other conditions and strokes and other sorts of things like that. Those last 10 years of their lives, they spent more money, they spent more time. Everything was all about just trying to hang on, and it was a miserable 10 years to watch.
Right.
So anything I can do to avoid that period of time, anything I can do to improve upon, I know I can't, there's no guarantee to prevent cancer or strokes or all that, but there are things I can do to lessen the chance of it. And by God, that's what it's all about. Not just living longer, living better, and not having to suffer, if you want to be blunt about it here.
Well, and that's where joining clinics like Lionheart is so helpful, because you need to know your biomarkers. You need to know what you can do.
Right.
And I think people, if they would just stop and say, look, I'm not going to buy that $7 coffee and start putting that money into longevity, and say, okay, rather than the coffee, I'm going to put that towards my longevity fund. And small things like that, I think they will add up, and that trajectory changes dramatically. And yes, you might die at 82, but you're going to be happy. you're going to have a great night with your family and friends, and then you're going to go to sleep and you don't. You're going to
feel better.
I mean, that's
exactly
what you want.
That's
right?
the dream. It's not going to. I watched my mother suffer the last 10 years of her life. She had Parkinson's, returned into dementia. She never exercised. She would have never thought of trying any of these things. It was miserable. Watch this. And then my dad trying to take care of her while he's declining.
And they probably spent tens of thousands of dollars on these treatments too. Yeah.
Everything under the sun, they'd try everything.
And it's too late. I mean, you can't. This is why you want to do like Lionheart and some of these other wellness clinics. You want to join them. You want to be active. Stem cell therapy, exosome therapy, biologics, different things and supplements. And I think it's something that you should incorporate in your daily life. I mean, would you agree with that? Howard,
early action is
you've seen a lot of patients.
Investment.
We're in a community here in Orange County where golfing is great, surfing is great, hiking is great. And you hear from people often, I used to ski, I used to surf, I used to bike, I used to hike, but then my knees hurt so bad or my joints hurt so bad that I stopped. When you have that first sign of joint pain, which is going to hit just about everybody, that's when to get a proactive plan. I strongly encourage you, if you're here in Orange County, come in and see Dr. Berkey, and we'll get on top of that. You don't want to wait until you're bone on bone, that you're on the list to have a knee surgery, $250,000 in crutches. Yeah. In fact, David, you have a personal story on this that I'd like you to share with the group, that
why you got into this whole thing.
Why you got into this whole thing.
I mean, for me, so I have a condition called Osgood-Schlatter's. And so
it's called what?
Osgood-Schlatter's. I wish it was an easier term. But basically, you have bone fragments underneath your kneecap. And they pull away from your shin bone. And they just kind of like bony islands. And for a lot of people, myself included, it can inflame and become very painful. And so about 10 years ago, I went to 2 different orthopedic specialists, and they said the same thing. They said, well, we'll just go in there, we'll cut it open, rip them out. And they made it seem like it was no big deal. And then I went and researched this, and I found out that this procedure only had a 50% success rate.
Ooh, yeah.
So it's about $40,000, 50% success rate, and I'm on crutches for 9 months. They made this seem so easy. Oh, it's just an easy procedure. And it might be relatively easy to do the procedure, but the pain, the trauma on the body is pretty dramatic. And it had a 50% success rate. And so I didn't feel comfortable with that. My whole family's in medicine, and I started talking to some other friends, and one of the doctors said, David, you should do biologics. And I said, okay, what does that mean? And he said, well, this is what it does, and this is what it do, and it's a 15-minute procedure. And he was very clear. He said, I don't know if this is going to work. He said, but there's a good chance. There's lots of data showing that it helps with inflammation, and I've seen it work with my other patients. And so I said, okay, let's try it out.
You're not cutting into your body.
Yeah, it's $4,000. It was $5,000 and 2 injections, and then you wait for 6 weeks maybe. And after I got the procedure done, there was 0 improvement for about 3 weeks, and then I woke up on week 4, and the pain was gone.
Wow.
And I mean, I couldn't. My pain was pretty significant. Walking upstairs, no jumping. Every time I played
You only
basketball,
got one treatment session?
just one treatment, and
It's remarkable.
Yeah, it was amazing. And that's
We recommend 3 at least.
Yeah. And that's where I got excited, because I'd done so many supplements and different things. And I said, hey, I've never seen anything like biologics that can effectuate change that quickly and that dramatically. And I think you've all heard from, all these celebrities and people have talked on these shows about different procedures. And it begs the question, well, why is this not more readily available?
That's the question.
And
yeah. Is it just for the rich and the wealthy and the well-connected here? The RFKs and the Joe Rogans and
No, not
everybody else?
anymore. I think it's a lot more available throughout the U.S. than people realize. And I think you do have to do a little research, but there are very good practitioners in the U.S. and clinics like your clinic are at cutting edge at helping people support their bodies correctly. And that's how I got into biologics, and that's what drives me still. And we have people call us all the time and say, hey, look, we did this or that, and it's working better, and it's really an amazing feeling as a business owner and entrepreneur to say, hey, something I'm doing is making people or helping people have a better
I wish
life.
we could keep this as an open-ended discussion. Maybe we'll have you come back and talk more about this, because as Howard does these periodic podcasts, I'm left with more questions than I have answers.
Yeah.
I want to know more. I want to hear more. But we're down to our last minute or two, because I got another show I got to cut to here. What are you guys thinking of doing together? Why are you even having this? You just met, and all of a sudden you're on the same wavelength here. And Howard says, let's come in and talk about this here. So where does this all lead?
Howard's the genius. That's the reality.
Thank you. That's too much.
He's certainly
we're-
way
we're-
ahead
we're-
of us, sending
We're
signals
more
back.
we're more scientists, and we're not as strong in sales and distribution as David's organization. You sell your products now to how many clinics?
We have about 300 throughout
About
the U.S.
300.
yeah.
So we're looking to our FDA cleared bioelectric stimulation for skin regeneration, hair regeneration, joint health, sexual health, rapid body toning and weight loss without muscle loss, and the longevity wellness program products to license them to clinics. And we're talking to David about helping us to reach out to some of those clinics. Right now we have a call center in Dominican Republic calling clinics, but people don't like to get calls from people they don't know. So we're thinking this might be another way. The other thing is that David is connected with cell production and biologics production facilities that are properly registered in Florida and in Utah. And we're talking about the possibility of accessing that for some of our clinics. So it's a two-way: us buying from them and us having their help in selling. Before we go, Paul, right downstairs, September 15th and 16th, we have the Clotho Conference.
This is at
ClothoConference.com.
UCI's Beal, B-E-A-L-L.
Yep.
UCI's Beal Applied Innovation, fancy word for a place that take technology from campus and try and turn it into something.
That's correct. And we have the world's leading researchers on Clotho for longevity and wellness, including Professor Makoto Kuro, who discovered Clotho in 1997,
Oh, wow.
Dr. Carmela Abraham, Dr. Patrick Sewell, Dr. Joseph Maroon, who heads up regenerative medicine research at University of Pittsburgh, on and on and on. And I'm sorry if I left a prestigious name off in the interest of time. It's going to be right downstairs, full day, September 15th and 16th. You can go to clothoconference.com.
Anybody can go just off the
Anybody
street?
can go, and a virtual attendance is $99. In-person attendance is $150. If you happen to be University of California Irvine faculty or students, it's $75. And one thing that's going to be special is we're going to have on display, to be seen for the first time by anybody on planet Earth, the very first womb for adults. So we have.
You've talked about that. I don't even want to. We'll just tease that one. A womb for adults, where you can grow, sort of like you go into this womb and you regenerate.
That's what we believe is the future of all of medicine. We think it's going to obsolete most hospitals, doctors, drugs, nurses.
Wow.
We're not quite there yet, but we will have a prototype on display that people will see for the very first time in their life, and they'll get a vision for the future. It's not ready yet. It's only in animal studies at this time. We have to be very careful. Safety always comes first, but we're going to pack that full of placenta, amniotic fluid, Wharton's jelly, Clotho-expressing stem cells. Artificial intelligence will scan a body, determine if the liver needs help, if the kidney needs help, pancreas, and robotics will deliver a catheter with a pacing lead to the organ of need, and we will regenerate organs one by one. And we're not, starting from zero here. Again, our group regenerated a heart in 1988. We've learned a lot about using nutrient hydrogels, about what works, what doesn't work, and we're ready to pull it all together into a womb for adults.
Howard, you're blowing my mind
Very
once
cool.
again here. Once again, I'm left with more questions and wanting to know more. If they want to know more about your guest, David, how do they learn about all the work that you've done and the work that you're doing? Because you do research in addition to not just a sales and marketing group.
Yeah, I mean, my Instagram or our website, rrg.bio, is easy. Yeah.
RG.
RRG, RogerRogerGolf.bio.
Okay. All right. Find out more about what David's doing and the work he's been doing. And you've been well known and written up as a biohacker and in the supplements business and all these other things you've been doing for years. Howard, how do they even approach you here these days?
Well, this is Orange County Talk Radio. And by the way, we were honored twice this month. We were nominated for Innovator of the Year by Orange County Business Journal. There's going to be a Oscars kind of ceremony this fall, and open the envelope and see if we won, but we were distinguished to be a finalist. And just yesterday, we made it as finalist for Octane Technology Life Sciences Company of the Year of Orange County.
Wow,
and again,
big deal.
a fall ceremony will unveil. So if you want to visit our clinic, it's lionheartlongevity.com. Click on the Newport Beach location, make an appointment with Dr. Berkey, Dr. Minna, Dr. Szymanski, Dr. Bourgeois, or Dr. Miller, and come on in and see us.
Or if you're around the country?
lionheartlongevity.com.
Lionheartlongevity.com. Well, I look forward to hearing more about Lionheart Health, the overall company that spawned this and all the other 57 billion things that you're doing here. And I can't wait for you guys to come back and tell us more. Thanks for joining us here today.
Thank you very much.
Thanks, David.